All right, joining me now, Dr. Mike Z, the Heme PT. That's as far as I'll take the alliteration for now. But Dr. Mike, thanks so much for joining me today on BloodStream. Welcome. It's good to have you.
Thank you so much. Good to be here.
We were just saying off camera, it's been a few years. There was a period at which I felt like I saw you every 2-3 weeks for, I don't know, maybe a few years actually. And then the pandemic hit and it's been a minute. But for people who aren't familiar with your work, let's just start with a little bit of background. So who are you? What is it that you do exactly? And what's your relationship to the bleeding disorders community?
So my name is Mike Zolonitsky. I'm a physical therapist, also living with severe hemophilia. For quite some time, I actually was not involved in the community whatsoever. My first 20 couple years, I wasn't really familiar with all of the resources up until I went to Pittsburgh and I was applying for some scholarship. And I sent an email out to one of the groups and they introduced me to the Western Pennsylvania chapter of hemophilia. And that is actually where I met my first hemophiliac outside of myself when I was in my early 20s. And since that time, I learned about the NHF annual meeting. So while I was still a student in my graduate degree, I went out there and I met way more individuals. And then I got involved with some of the nonprofits like HFA and Coalition for Hemophilia B. I started doing some presentations of aquatic physical therapy, just safe exercises, pain management alternatives. But more recently have really talked a lot about how to apply kinesiology tape to reduce joint pain, joint inflammation, and how to manage acute joint bleeds to prevent things like target joints. So I would say in the past 7 years, I have traveled to about 35 states, still trying to hit the other 15. So for any chapter that has not utilized me, I'd love to go all over. But my goal is to really educate the community of bleeding disorders, men and women, on how they can live life pain-free, how they can manage their bleeding disorder, and how exercise can be modified for absolutely everyone to live the best life possible.
Outstanding. And where do you work professionally? Do you work in a clinic or where do you operate as a PT?
So when I graduated about 8 years ago, and I've been in the same outpatient facility for the past 8 years. We specialize in orthopedic and neurological physical therapy. So I see a lot of patients with MS, stroke, Parkinson's, but I really treat a lot of people in the community just from word of mouth. I've had patients come from tri-state area to see me out in Old Bridge and Marlboro, New Jersey. And that is really where I saw the success of how physical therapy can really help everybody. I've treated patients with and without inhibitors. I've treated patients with mild all the way up to severe hemophilia. And I've had a lot of patients coming in who have had surgery or have been told they need surgery, but were never really guided in the right direction and have been able to really develop individualized treatment plans and exercise programs to help patients get out of pain. And actually, some patients even avoid surgery.
So there's so much to your story that we're not going to get to dig into all of it today. I want to talk to you about the tape. I want to talk to you about the role of PT in general when treating people with bleeding disorders and the things that you've noticed along the ways, maybe your top couple of takeaways that people should hear about. You just I think, maybe shared one about how sometimes with the right PT regimen, the right provider working with you, you may be able to avoid a surgery that another doctor may have said you need. So that feels really important and is an endorsement for physical therapy. But I want to roll the tape back and go to childhood. I'm intrigued by the fact that you did not meet another person with hemophilia until your early 20s. So you didn't grow up going to hemophilia camps, it sounds like. You didn't grow up going to patient advocacy, education weekends, family weekends, that kind of stuff. The scholarship, and frankly, that was true for me too. I went to camps for kids with different illnesses growing up, but it was when I went to college, applied for a scholarship in New York, that I really learned about the advocacy groups and that. So I think those scholarship programs for the EDs out there, it's important. It brings people like Mike and I back into the fold or into the fold for the first time. But what was it that, other than the scholarship, what was it that was your light bulb moment that, I actually want to focus at least a portion of my professional energy on people like me with bleeding disorders?
Yeah, so I think growing up, I didn't really interact with too many other individual bleeding disorders because I've never met them. But I never went to the family camps, which I wish I would have attended them at a younger age. But I think it wasn't until that I met the particular individual with hemophilia and they saw, I guess, how well I was doing for somebody with severe hemophilia. At the time, I was about 25 years old, and really guided me and said, when you finish your doctorate degree, you should really talk to the community. And at that point, I'm like, yeah, that would be cool. I didn't really even know what HFA or NHF were. But that is when I kind of met the right people, and they got me coordinated with HFA and NHF and Coalition for Heme B. I actually went to the World Meeting in 2018, met a ton of other people. That's actually when I met Hope for Hemophilia Group. But just learning about all these different organizations and how many people we can truly help was when I said, this is definitely what I want to focus on when I graduate, because there's a lot of people out there that need assistance, and I want to be there to help provide it.
So let's talk about the tape, because it also became commonplace for me, and I would know you're at a meeting because I would see people walking around with blue tape around their knees, blue tape around their elbow, blue tape on a shoulder. And I was like, oh, Dr. Mike must be around. And sure enough, you would be there. But also time and time again, these same people would be like, hey, man, this thing was working. This is cool. So what is this tape? What's the magic? Why does it work? Can I use my tape? Do I have to buy special tape? What's the magic of this tape?
Yeah, so the first time, so I was out, it was actually for the New York City chapter. They asked me to do a presentation, and they've seen the aquatic therapy. They've seen me do some TheraBand. So they asked me, what I'd be interested in doing. And I just thought, why don't we show kinesiology taping? Because I saw how effective it was for the patients in our facility. And after that first day, I had one of the individuals send me a message the next morning, and he said, this is the best my knees have ever felt in so many years. This is after having bilateral knee replacements. The tape, there's nothing on it. There's no medicine on the tape. It's just applying it in a certain direction to help activate or inhibit muscle contractions to help it work better with the body. It's also utilized for swelling reduction. But after he gave me that feedback, I sent an email to HFA. I kind of talked to the programs director. At that point in time, it wasn't a program. And when I put it up as a program, I started making posts on Facebook, and a lot of the chapter executives were saying, hey, this tape looks good. Let's bring it out here. Coalition for Hemophilia B, there's a huge, every year I go out and I do the taping for them, and it's been super successful. But it's really a way for individuals to help manage their pain on their own. Unfortunately, a lot of treatment centers or even physical therapists are not really familiar with the taping and how it's performed, so the patients aren't getting that to themselves. But it's worked really well, and it's a presentation that I just kind of talked about one time 5 years ago, and it's something that I do pretty often now.
So you kind of addressed where I wanted to go next. If I were to just buy this tape, and it's called kinesiology tape, is that the name of it?
Correct. Yep. KT tape, kinesiology tape.
So I buy some kinesiology tape, some KT tape, and I start wrapping it around my leg, but I don't know what I'm doing, so that's not going to help. So what can someone do? Because it sounds like it's how it's applied as much as the tape itself is what I gather from what you just said. So short of being able to see you at a patient advocacy group meeting, or if I lived in Jersey or the tri-state area and could see you privately, but short of that, what could someone like me who's intrigued by this do to get to a place where I have the tape and I know how to properly apply it?
Yeah, so that was a question that I was always asked. So I developed a YouTube channel. That way people can access it. It's not the best of quality of videos, but if you YouTube Hemo Doc, my name will pop up. And I have a few videos on there. We're actually working on getting more videos on a platform called factormyway.com. Those are not up yet, but we are really trying to get a lot up on that website. But in the meantime, if you Google HemoDoc, I have kinesiology taping for the ankle, KT tape for the shoulder, for the knee, for the back, swelling reduction. So there definitely is a strategy of how to apply it and how much force to put on if you're trying to do something for the knee, how much force for the ankle. So, there definitely is a little bit of a strategy to it, but check out HemoDoc YouTube channel.
And we'll have a link to that too in the program notes for ease. When you are working with patients with bleeding disorders, what do you often find is either a misconception or just an incorrect idea about physical therapy that might be, worth sharing with listeners who perhaps have that same idea, bouncing around in their head as a reason to not engage with physical therapy or as a reason that they just can't fully appreciate what it can do for them? What do you hear? What are the misconceptions that you have to break through?
Yeah, so a lot of the misconceptions is that, exercise or physical therapy will make the pain worse or make bleeding increase. And maybe they're going to a physical therapist that is not familiar with hemophilia or how to treat bleeding disorders, and they're being treated over aggressively. So it's really finding the balance of how do you push someone to the point where they're going to make progress and you're not going to cause more inflammation. And it's super important to find somebody who understands bleeding disorders, or if they have never heard of hemophilia or von Willebrand's disease or some other coagulation dysfunction, that they're going to look into it and understand how to treat the patient appropriately, but also making sure they're getting good physical therapy. Because unfortunately, there's a lot of PT out there where you're just kind of going on the bike, getting a heat pack, doing a few stretches, and that's the end of your session. So really make sure that PT that's working with you is attentive to your exercises, making sure you're not getting more pain after the fact, making sure you're not confusing muscle soreness for bleeding, because if someone's never worked out before and they do a set of 20 squats and the next day that both of their thighs are really sore, that's a normal response. But if one knee completely blows up and is swollen and the other leg is fine, then that could be something abnormal. So really just trying to reintegrate into exercise the appropriate way instead of pushing everything all at once.
What is the difference between exercise and physical therapy?
That's a great question. I've never had anyone ask me that question. Exercise is a portion of physical therapy. With us, with myself specifically, we want to look at how the body works as a whole. With physical therapy, if someone comes in with knee pain, I'm going to look at the full approach. I'm going to look at their ankles. I'm going to look if one leg is longer than the other. I'm going to look at the hip mobility. A lot of times people with sedentary jobs, or if someone's doing something with one leg compared to the other, you create a lot of muscular imbalances. So our job as a PT is to improve muscular imbalances, improve strength, improve range of motion, improve mobility. We utilize a lot of manual therapy, which means that we're actually working on the body. So some of my patients have come in with 20 degrees of knee flexion instead of the 135. They've come in with self-fused ankles. Part of physical therapy is we're going to manually stretch, manually massage the muscles, break up scar tissue. Whereas just exercise, you're not going to get any of, you're just going to do everything on your own.
I'm also, as I'm listening to you talk, I'm thinking about just how do I think of physical therapy? And I think about it as something that, maybe you do after surgery, or maybe you do after a big injury. But as I'm thinking that, I'm like, I don't think that's correct, though, because in theory, especially living with a chronic condition like hemophilia and arthritis as a result of it, and you just referred to self-fused ankle, got one of those. What could I do if I realized, hey, I may not be coming off of a surgery or directly responding to a recent injury, but I know that my body needs help, and I know that if I just go to the gym and go to the cardio machine and go over to some free weights for 20 minutes, I don't think that's going to cut it. What can someone like me do? Like, can I call my HTC and say, hey, I want physical therapy? Can I call my doc and just request that without there being some sort of injury or incident? Or
Yeah, and for me, growing up, I was never really given the education of, hey, you should go see a physical therapy. Education that I received was, oh, you have pain in your ankle or your knee, you should stop playing basketball.
Right.
But I was playing basketball. I thought I was really good until I stopped growing. So the education should be, okay, hey, you're having difficulties or you're having limitations or you're having increased pain/swelling when you play basketball or when you go for a walk or when you go for a hike. You should go see a physical therapist to get your ankle evaluated. Maybe go see a podiatrist. I know a lot of treatment centers are doing ultrasound guided imaging, which, mine currently not do. However, our sports medicine doctor on staff, he's doing that. So really, currently to this date, I'm trying to educate my own treatment center on, hey, I'd love for you to just let every single patient that comes in here, let them know that I can do an assessment on them. Because for myself, I go there once a year. They look at my balance, my range of motion, my walking for about 3 minutes, and there's no modifications. There's no education. And I know some treatment centers around the world are amazing. Some don't really give the appropriate education. But anyone, I feel like everyone should always be evaluated by a physical therapist with any type of joint issues and maintain a good exercise regimen. The ankle in particular, you're going to go to the gym, do squats, lunges, deadlifts. Those are working on bigger muscles like your quads and your glutes. But my ankle patients that come in, we have them take their shoe, their sock off. We're doing very small motions, stability, balance, mobility that they wouldn't get going to the gym.
Right, and that I often overlook when I exercise. I'm not taking the time to work those tiny muscles in my ankle because that's not going to look good on vacation, right? I'm doing other stuff, so that's I think your example right there is spot on.
Unless you're doing your calves, that could look good on vacation.
That's true. Yeah, mine do not. I got stick legs. I got chicken legs, and I it is what it is. But maybe I need to talk to Dr. Mike about how to change that. How is your hemophilia health today? How are you doing?
I'm doing pretty well. I mean, I could honestly say for the last 15 years, I haven't really had any severe joint bleeds or joint damage. Things are starting to, hurt me maybe a little bit more now than before, but I just think that I am aging. But I would say overall, my health is great. I try to exercise on a daily basis, at least 5 times a week. My job as a physical therapist, I'm pretty active. So, I'm doing pretty well.
And that's actually the last thing I want to ask you about today is this idea of being active, because you hit the nail on the head from my experience. I think I'm a few years older than you, but we're in the same bracket. And I too grew up specifically wanting to play basketball and other stuff, but being told, no, it's not for you, and you got to sit down, and you can't be involved. I would play, I'd get hurt. But what's your perspective on activity, sports, and what people with hemophilia can truly be physically capable of now in 2023? What's your take?
Yeah, I think with the medication, I mean, growing up, I wasn't on a prophylaxis regimen. That didn't really become a thing when I was, I believe, like 10, 11 years old. When I became about 12 or 13, that's kind of when I started prophylaxis. But I think with the medications of how advanced they've become, and now that, everyone's on that kind of prophylaxis regimen, just making sure that you're not causing a consistent damage to a particular area. Sports are great. Obviously football is dangerous for everybody with and without bleeding disorders. So that's always going to be a questionable thing. But, other sports, there's always a risk or a benefit. If you stay home and you play video games all day, you're not going to really have good cardiovascular endurance. You're not going to really build strength. Versus if you go out and play baseball or basketball, yes, there's always a chance you're going to slip, fall, twist an ankle, maybe hurt a knee. But I think staying active and doing something on a consistent basis is key for anybody.
Yeah, for social health as well as for physical health too, right? Well, Dr. Mike Z, blood brother, PT, I appreciate your time. I appreciate your expertise. It's fun. I enjoy talking to guys who also have hemophilia and who have expertise in specific ways and the ways in which their hemophilia experience and that expertise intersect. For me as someone for whom that description fits, it's always fun. So we've never had a chance to quite do this. So in spite of knowing you for, a number of years now, we've actually never even had this much concentrated time together live, virtually, in any format. So it's a pleasure to get to know you better, to hear more of your insights. And now I look even more forward to the next time that we're in the same place together. I'll have more specific questions, I think, to ask you, particularly about my left ankle, but we'll save that for later. And again, for listeners, the link to his YouTube channel, it's in the show notes. Just one more time, would you mind saying it for people as well? What's the YouTube channel?
Hemodoc, HEMODOC.
Nice and simple. Hemodoc on YouTube, link in the program notes. Dr. Mike Z, appreciate you, man. Thanks for coming on BloodStream today.
Absolutely. Thanks, guys.